So today I'm reacting to an epic ring dinger compilation.
Ladies and gentlemen, can I please have your attention?
This video is sponsored by Human 2.0, your trusted source for online training in body weight exercises, kettlebells, animal flow and primal movement, and injury prevention. Hey interns, I'm Dr. ChrisRaynor and I am not your everyday ortho. I make sports injuries, orthopedic surgery, and medical topics easy to understand and entertaining so that your experience with healthcare can be better. Okay. Today for Orthopedic Rounds, I'm going to review a video about a type of chiropractic therapy known as a ring dinger. I will share my thoughts on the treatment from an orthopedic perspective and how I think that patients are affected both subjectively and objectively. Some of you have asked me to take a look at these, so today I am going to oblige you. You're welcome. So clearly, I'm going to review a chiropractic video.
Another one.
I expect that some of you will not like that. So here are my ground rules so that you can say that I am not part of the Illuminati, although I'm sure you probably still will. Number one, I am not gonna say that any of these patients should take drugs instead of see a chiropractor. Number two, I'm not gonna say that any of these patients should have surgery instead of seeing a chiropractor. Number three, I do not think that surgery is the solution for all back or leg pain problems, and I will not suggest that these patients undergo surgery to fix their problems. Number four, I am going to speak about the techniques that I observe and the related medical science. Number five, I am not here to complain about chiropractors or them taking patients away from orthopedic surgeons. With the ground rules out of the way, let's get to the topic at hand. This is going to be a bit of a longer video, so you can use time points to skip ahead for specific comments. Now, I don't know what the heck a ring dinger is.
Oh yeah. Yes, sir.
But as a casual observer, it looks kind of excessive. It is a good thing that the chiropractor checks the patient's reflexes before and after the treatment. This assessment documents whether there has been a change in the neurologic status after treatment. More importantly, the test after the adjustment reveals whether or not he has created an upper motor neuron lesion, which is an interruption of the cortical supply to the lower motor neurons. And that just describes a break in the pathway from the brain to the motor nerves in the lower extremity. More specifically, a disruption of the nerve supply above the level of the reflex arc which is being tested. In this case, it would be at the level of the neck since he is trying to pull people's freaking heads off. This type of iatrogenic injury would be demonstrated by hyperreflexia, or increased reflexive activity when tested.
And just keep your teeth together, breathe through your nose.
He warns the patients to keep their teeth together. This is important since he is applying his traction force through the jaws. If patients have their mouths open when the sudden traction is applied, the jaw could be dislocated or the mouth could be rapidly slammed shut, causing breakage of teeth. And as he is warning people of this, I'm sure that this has happened to at least one person.
Oh yeah. Yes, sir.
Generally, in his videos, only a single quick traction maneuver is applied. However, here he has applied two in quick succession. I am not sure why two were needed. It would be interesting to find out what he was experiencing or seeing that caused him to do this. Perhaps he didn't get the sound that he was looking for. At any rate, it looked like he wasn't happy with something, so he quickly hit it again.
Had to do a double dinger on you today.
The chiropractor asks the patient if he felt it all the way down his spine.
You felt it all the way down though, didn't you?
This implies that some sensation was expected to travel down the spinal cord to some lower level. This is an example of a Lermite sign. Lermite sign is a sudden electric shock-like sensation that passes down the neck and down the spinal cord, radiating into the arms and legs. Usually, it is triggered by bending the head forward towards the chest. It is essentially a type of neuropathic pain, and it is an example of a paroxysmal symptom that lasts for only a few seconds or minutes. It is believed to be caused by stretching of hyperexcitable nerves of the dorsal column of the spinal cord, or the posterior portion of the spinal cord. It is elicited by movements of the neck. Although most commonly this is flexion, it can also be caused by neck extension. Given the position of the towel, the king stinger traction would cause a combination of traction and extension. Given that most people are not aware of what the Lermite phenomenon is, there is a possibility that people may interpret this sensation as a positive thing, when in fact it is a pathologic sign.
There we go.
Oh my God!
Yeah.
Here, there is an opportunity for the practitioner to take advantage of this ignorance, leaving the patient to think that this was some beneficial force radiating through their body, when in fact, It is a type of neuropathic pain. It makes me wonder, how many of these king stingers can you have before it becomes a problem at a cellular or a neurological level? To be honest, I don't have this answer. But when assessing neurologic patients, a Lermite sign is a marker of pathology, not the celebratory dance after a touchdown.
Breathing. Look at there, you're still kicking, you're all right.
The chiropractor checks the patient's patellar tendon reflexes and assures her that she is still kicking. But in the event the patient had been injured by the technique performed, we would actually expect hyperreflexia at the level of the knee. Hyperreflexia is a condition where the reflexes are more vigorous than would normally be expected. It is caused by a lack of inhibitory signals from the brain to turn down the volume of the lower motor neurons to the stimulus of tapping the patellar tendon. If anyone starts kicking more vigorously after one of these adjustments, then Houston, we have a problem. In this case, the chiropractor felt that the initial traction wasn't enough. He felt that it was necessary to perform a rotational adjustment as well. Given the intimate relationship of each vertebrae with one another at the facets, I am not sure how these adjustments are beneficial for the cartilage of the facet joints themselves. We generally seek to avoid translational movements at other joints because of the potential for injury of the ligaments that stabilize the joint in question. I am not sure why chiropractors would believe that this does not also apply to the spine. But unrestricted percussive tension at a joint is a perfect way to destabilize a joint.
Him back in. There you see the awkward landing and right away.
After watching a few of these adjustments in succession, I start to wonder two things. One, how is this technique standardized or reproducible? There is not a gauge or instrument used to determine that a prescribed amount of tension is being used for each patient. How does the chiropractor know what amount of tension is required for each particular patient? And how does he ensure that they are using the exact amount of tension required and no more than is necessary? It would be good for the chiropractor to demonstrate this so that we can see how he determines this information and how he regulates the force that he is applying. 2. Why is it necessary that the technique is performed in a ballistic or percussive manner? This is not how facet dislocations are typically reduced. In a trauma setting, facet dislocations are reduced in a controlled manner using a controlled amount of force with the assistance of fluoroscopy to monitor progress. The technique demonstrated here is certainly less controlled than that.
That just is breaking loose those old fibrotic adhesions and
The chiropractor states that the sensation the patient is experiencing is simply breaking loose the old fibrotic adhesions
scar tissue that develops in there.
and the scar tissue that develops in there.
What?
What adhesions? Or what scar tissue? In where? Come on, man. Does he have any radiographic imaging or intraoperative evidence to verify that this is actually the case? I would venture to guess that this is not what patients are experiencing, but I would be interested in learning how he knows this.
Even though that might look like it really hurts, it's great.
Even though that might look like it hurts, that's because it does. It's called neuropathic pain. I've explained it above. It is generally not considered a good thing, except in chiropractic care,
It's great.
when you get a fling binger. In this video, a cervical manipulation often follows the bring flinger.
Just like that. Look at that. Scar
This appears to be performed in a rotatory manner while the cervical spine is held
Look
in
at
flexion.
that.
Combined flexion and rotation is a typical mechanism of injury that can result in a cervical facet dislocation. A cervical facet dislocation is an unstable problem where one or both of the facets at a given level jump over the facets of the adjacent vertebrae. This injury pattern requires reduction and subsequent stabilization. I cringe when I see this type of manipulation as I wonder how the chiropractor prevents this type of problem. He adds,
You've got a lot of scar tissue and fibrotic adhesions down in there and in and around where you had that fusion done.
altered forces present at and around levels previously fused makes me nervous about spinal manipulation in this context.
That's it, boy. You're gonna be a crack addict, favorite.
The chiropractor talks about people becoming crack addicts. This language makes me wonder why the chiropractor is promoting any type of treatment that encourages the patient to return in an addictive manner. As musculoskeletal care professionals, Our goal should be to help patients to learn the knowledge and skills to allow them to move and function pain-free without restriction, and to live their lives independently without medical intervention. Anytime I see a care provider encouraging behavior contrary to this goal, it gives me pause for thought. If a patient frequently returns for a particular treatment, how have they learned to look after themselves? After all, you can give a man a fish, or you can teach him how to fish for himself.
The pins are locking in your pelvis here to stop you from moving. I get all the movement in your spine.
The chiropractor performs a sting ringer without the bolsters that he typically uses. The bolsters are used to block translation of the pelvis across the table toward the chiropractor so that the effect of the traction can be isolated to the spine above the pelvis.
But I still, with the high velocity,
The chiropractor assures the patient that despite the fact that he is not using the bolsters, he will still be able to achieve the desired effect by ramping up the velocity of the adjustment. He then proceeds to percussively yank the patient 2 feet up the bed by his neck.
Okay.
If we estimate this patient weighs approximately 200 pounds, then the force that must be overcome to move this patient from his resting position is 890 newtons. Given that actual facet dislocations can be reduced using less than 30 pounds of traction, it begs the question of what 900 newtons of traction does for the ligamentous tissues of the cervical spine. If 900 newtons of force is not good for your anterior cruciate ligament, how much better is it for the soft tissues of your neck?
Oh yeah.
yes sir. And that's why we call it ring dinger.
Your ulnar nerve, one of the main nerves of your upper extremity, travels around the inside edge of your elbow against a portion of bone called the medial epicondyle. The location of the nerve leaves it susceptible to impact if the elbow is banged against a hard object. When this happens, an unpleasant electrical shock sensation runs down your arm from your elbow into your hand. This is what it means to hit your funny bone. Usually it is not that pleasant an experience, and it is definitely not something that you want to repeat or become addicted to. As a healthcare provider, I could bang you on your elbow over the ulnar nerve, and I could even call it a bling blinger. But it wouldn't mean that it was a good thing or that it was doing something beneficial for you. Know what I'm saying?
Oh yeah, very good.
You gotta be kidding me. All I can say is, what the am I being punked right now? If I ever did something like this to a patient, I would find myself explaining my actions to my regulatory colleagues.
That's money.
That's the money shot.
That's the bunny shot. Yep, no doubt.
Tony's spine has to be one of the most complex.
The chiropractor states that his patient Tony is one of the most complex spines that he has adjusted over his career.
Out of the hundreds of thousands of spines that I have adjusted in my 36-year career.
He states that he has adjusted over several 100,000 spines over a 36-year period. If we take him at his word and round it to 200,000, that is 5,555 spines annually, 106 spines weekly, and approximately 21 spines daily, assuming no vacations, of course. That is a pretty ambitious pace for a therapist that doesn't leave much time for assessment.
I know it's a little traumatic on the first one.
It's painful, but
we're
it feels
breaking
good.
scar tissue loose down there near the low back lumbosacral region.
Scar tissue down where? Really?
Probably where you're getting a lot of your radiculopathy from.
If the chiropractor suspects that scar tissue is causing radiculopathy in her lower extremities, why is he performing a cervical adjustment? Radiculopathy is a localized phenomenon that results from compression of a nerve root at a particular level. If you have radiculopathy in your lower extremity, it is caused by compression of a nerve root in your lumbar spine. Your cervical spine has nothing to do with the compression in your lumbar spine. An adjustment of the cervical spine has no bearing on the compressive pathology downstream. After watching this video compilation, I am left with the impression that rather than a tailored approach to each person's individual pathology, the chiropractor tends to use an assembly line approach to treatment. Every person gets the same adjustment regardless of pathology. In all fairness to the chiropractor, this is a compilation video of many different treatment sessions showing this particular modality of treatment. However, the fact that he owns a specialized treatment table for this technique suggests that it is a significant part of his practice. In fact, Many of the patients shown have traveled great distances to receive this treatment modality.
Just like that. Yep. Home run. Keep breathing.
He gives the patient repeated encouragement as she deals with the discomfort of what she has just experienced.
Breathe deep through your nose and out through your mouth. Keep breathing though. I know that's sore.
It really doesn't seem like she has experienced something pleasant.
There you go. I know that's tender. That'll take that pinching off that nerve though.
I almost expect him to say something like,
It'll put hair on your chest.
Yes, sir. I know you felt that all the way down.
Man,
Yes, sir.
there is no other place where this would be tolerated. If I said to someone that came into my office that I was going to pull them off a table by a towel around their neck, I am sure that they would look at me like I was insane. This is literally insanity. As an orthopedic surgeon, I don't even use this type of force when I am reducing fractures that have been displaced significantly. This is absolutely bonkers. And there is no way that this chiropractor or anyone else can tell me that they are applying a reproducible amount of traction using this technique. That is unless crap ton is a value with several significant digits. Palmer diversified rotary brake. Like what? One final thing. Many of the chiropractors on YouTube use microphones to amplify the sounds of the spinal adjustments. It's as if the sound is the desired outcome. However, the sound and the effect of the adjustment are not related. A louder sound is not associated with a better adjustment or vice versa. So I'm not sure why there is such an emphasis on sound. ASMR is one thing. Chiropractic therapy is quite another. Amplified cracks are not the same as effective treatment. If only it were that easy. Thanks for watching. I will see you for rounds next week. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.